16 states are now reporting an upward trend in COVID-19 hospitalizations since Memorial Day, when a lot of states started to reopen, one of them being Florida, a state that one model projects has, quote, all the markings of the next large epicenter of coronavirus transmission. And Florida has been a place that has done very well so far. California, you've got all citizens now mandated to wear face masks in public places. So joining me now, Alex Berenson, former New York Times reporter, author of Unreported Truths About COVID-19 and the Lockdowns. Alex, good to have you back tonight on the program. So this is good to have you here. I just want to jump in with my first question here. Are you surprised about the upward trend that we're seeing in these hospitalizations? 16 states since Memorial Day sounds significant when it's the hospitalizations category.
Yeah, so hospitalizations matter. I mean, they do matter much more than the top line case count, because that can be affected by so many things. Here's what I would say. If you look, for example, at Florida, Texas, Arizona, so the three big Sunbelt states that have gotten the most attention. Those three states have 60 million people total. We are talking about roughly 7,000 or 8,000 hospitalizations among the 60 million people in those states. And we're talking about hospitalizations increasing 200 a day, 300 a day, maybe. Is that a good thing? No, it's not a good thing. We'd like to see hospitalizations flat or down. But in New York State, okay, at the time New York State had the crisis, and it was really New York City. New York City has 8.5, 9 million people. There were 15,000 people in hospitals. Okay, this is an order of magnitude lower. And it's pretty crazy that, you know, I'm spending my time, and a lot of other people are spending their time, clicking on the case counts from Florida, trying to figure out if, 230 people got hospitalized today, or 180, or 150. The fact is, these numbers, we are nowhere near what we were, in New York 3 months ago. It is unlikely, I feel confident saying that we will ever get there. And by the way, there was just a new report out of North Carolina just today about antibody testing, which, to remind viewers, antibody testing is how many people have had the virus and recovered. That report showed that almost 10% of people in the state of North Carolina have antibodies right now. That's roughly 15 to 20 times the number of people who have active coronavirus infections by tests. That again says that the infection fatality rate, that the lethality of this virus is much lower than the worst case estimates have been. So is it good that hospitalizations are going up? No. Is this the same people who've been trying to panic the country for 3 months, trying to panic the country again? Yes, it is.
All right. I want to get a quick thought from you on this. This is Scott Gottlieb, formerly of the CDC, on CNBC today. Watch this.
If you look in Texas in particular, about a quarter of all the hospitalizations are between the age of 20 and 29. And in many counties, certainly the counties around Austin, a majority of the new cases that are being diagnosed are under the age of 30.
So we tried to confirm that with the authorities in Texas. We could not confirm that. But I thought that was a pretty shocking statement that he made.
It is shocking if it's true. Now, cases are positive tests. I don't care. I'd rather have younger people be getting the positive test results. But he's talking about hospitalizations. They're much less likely to get sick. Yeah, I know. And that, I'm going to look at that myself as well. I haven't been able to confirm that number either. So I think that's something, again, this is not what we are hoping will happen, but it's not something to panic about. It's something to watch.
Yep. All right. Thank you very much, Alex Berenson. Always good to talk to you. We'll see you next time.
Thanks for having me.
More of this